Hello, everyone. This is Elshad Hassanov. I'm a medical oncology fellow at MD Anderson Cancer Center. I'm here in the practice update with Dr. Eric Yonash, who is the faculty in our GU Medical Oncology department. It's nice to have you, Dr. Yonash, in the practice update today.
Thank you. It's really, really nice to be here.
So as we all know, we are going through unprecedented time with the COVID pandemic, and as for management of each patient and disease, we have some nuances that we change certain approach that we were doing the pre-COVID time. In terms of the VHL patients, how did the pandemic affect the care of the VHL patients, and what kind of strategies did you take to adapt to this situation?
Yeah, so the challenges really are, obviously active surveillance is a big piece of the care of these individuals. And, we've recommended for our patient population that you should be smart about how you work with your physician team and care team to adjust that. So you want to make sure that you get screening studies if they're absolutely necessary, take precautions. If you can defer things and getting these studies puts you in an at-risk situation, then it's something that you should. But if you really need care, you should get it. It absolutely trumps the risk of getting COVID, especially with all of the safety measures hospitals are taking.
And will you tend to use like more virtual visits or in-person visits, continue to have the in-person visits for the surveillance, or what was your style in the care of these patients?
It was a bit of both. We tried a little bit more virtual, and where there were in-person visits required, we still did perform in-person visits.
I see. Okay. Thank you very much. This was also helpful for us for taking care of the VHL patients and adapt to this situation. Dr. Yonash, as now fortunately we have the vaccine for the COVID-19, what do you recommend for the VHL patients regarding to take the COVID-19 vaccine?
Yeah, it's a really good question, Elshad. At this point in time, we don't have any evidence that individuals with von Hippel-Lindau disease should be considering vaccination any different from the general population. And I would recommend that if you can get vaccinated, you should get vaccinated. And arguably in some situations, there's different categories where you could say that individuals might be at slightly higher medical risk. I would say that if there are circumstances from VHL that arise that put you in those higher risk categories, that might prioritize you for getting vaccine. But otherwise, I would just say that follow the guidelines, get vaccinated when you can.
Excellent. Thank you very much. This was very helpful recommendations since these are the nuances of the care in these times. It was very helpful. Thank you.
Thank you, Elshad.